Ever wondered, what are the most common diseases that make us sick? Well, today, we're going to take a deep dive into this subject. We'll explore the most prevalent ailments that afflict people around the globe, from the well-known to the less commonly recognized. These conditions impact countless lives every day, causing a range of symptoms and complications. But don't worry, it's not all doom and gloom. By understanding these diseases, we equip ourselves with the knowledge necessary for early detection and prevention. From cardiovascular diseases that affect our hearts and blood vessels, to respiratory diseases that challenge our ability to breathe, to silent killers like diabetes and Alzheimer's. We'll also touch on the fearsome Big C, cancer, and infectious diseases like HIV/AIDS, malaria, tuberculosis, hepatitis, and the common flu. It's a comprehensive rundown you won't want to miss. Without further ado, let's dive into the top 10 most common diseases that may make you sick. Starting our list at number 10, we have cardiovascular diseases. Cardiovascular diseases, often known as heart diseases, are a collection of disorders affecting the heart and blood vessels. They are prevalent worldwide, affecting millions of individuals each year. They're majorly caused by poor lifestyle habits like unhealthy diets, lack of physical activity, tobacco use, and excessive alcohol consumption. Symptoms vary greatly, depending on the specific disease. They may include chest pain, breathlessness, and even fainting. However, some people may not experience any symptoms until they have a heart attack or stroke. It's a silent killer that could be lurking unnoticed. The good news? It's preventable. Maintaining a balanced diet, regular exercise, avoiding tobacco, and limiting alcohol intake are some of the ways to keep your heart in check. Regular checkups can also help detect problems early, increasing the chances of effective treatment. Keep your heart healthy, and it will keep you going. Next up, at number 9, we have respiratory diseases. These are the ailments that affect our lungs and the air passages that lead to them. Common respiratory diseases include asthma, bronchitis, and pneumonia. They can be caused by a multitude of factors, such as viruses, bacteria, and even environmental pollutants. People with respiratory diseases often experience symptoms like coughing, wheezing, shortness of breath, and chest tightness. These symptoms can vary in severity, but they all interfere with our ability to breathe freely. So, what can we do to prevent these diseases? The answer lies in maintaining a healthy lifestyle. Avoid smoking, as it is a major cause of respiratory problems. Regular exercise can also strengthen your lungs. And don't forget the importance of good hygiene. Washing your hands often can help prevent the spread of viruses and bacteria that can cause respiratory diseases. And finally, remember to get vaccinated. Vaccines are a powerful tool in preventing many diseases, including those that affect the respiratory system. Remember, every breath counts. At number 8, we have diabetes. This is a disease that affects millions worldwide and is characterized by the body's inability to effectively utilize or produce insulin, a hormone that controls blood sugar levels. There are two main types: type 1, often diagnosed in childhood, where the body can't produce insulin, and type 2, usually diagnosed in adulthood, where the body becomes resistant to insulin. The symptoms of diabetes can be subtle, often mistaken for simple fatigue or aging. These may include frequent urination, excessive thirst, unexplained weight loss, and blurred vision. If left unchecked, diabetes can lead to serious complications such as heart disease, kidney damage, and even blindness. But don't fret, diabetes can be managed and even prevented. A balanced diet rich in fruits, vegetables, and whole grains, coupled with regular physical activity, can significantly reduce your risk. Remember, the power to prevent diabetes lies largely in your hands. Maintaining a balanced diet and regular exercise can keep diabetes at bay. Coming in at number 7 is Alzheimer's disease. Often thought of as a natural part of aging, Alzheimer's is actually a progressive brain disorder that slowly destroys memory and thinking skills. But what causes it? It's a question scientists are still trying to answer. The disease may be triggered by a complex mix of genetic, lifestyle, and environmental factors that affect the brain over time. So, how do you know if someone is affected? Early signs can include difficulty remembering recent events or conversations, confusion about time or place, and changes in mood or behavior. As the disease advances, individuals may experience severe memory loss, disorientation, and changes in personality. Prevention, while not guaranteed, can be aided by maintaining a healthy lifestyle. Regular physical and mental exercise, a balanced diet, and staying socially active can all help to reduce the risk. Alzheimer's is a reminder that our brains need care too. Remember, mental health is as important as physical health. At number 6, we have cancer. A notorious word that strikes fear in the hearts of many, cancer is not just one disease but a collection of related diseases. In all types of cancer, some of the body's cells begin to divide without stopping and spread into surrounding tissues. There are over 100 different types of cancer, each classified by the type of cell that is initially affected. Some of the most common include breast cancer, lung cancer, prostate cancer, colorectal cancer, skin cancer, and stomach cancer. Cancer's causes vary greatly, but they can include a poor diet, exposure to environmental toxins, genetics, and certain behaviors like tobacco and alcohol use. Symptoms also vary depending on the type, but can include lumps, unexplained weight loss, persistent cough, and changes in bowel movements. Prevention methods can include maintaining a healthy lifestyle, regular checkups, and early detection through screenings. Remember, early detection of cancer can save lives. Number 5 on our list is HIV/AIDS. A double whammy of a disease, HIV, or human immunodeficiency virus, weakens the immune system by attacking the very cells designed to protect us from illness. If left untreated, HIV can progress to AIDS, or acquired immunodeficiency syndrome, the final stage of the infection. Now you might wonder, how does one contract HIV? It's typically transmitted through bodily fluids like blood, semen, vaginal and rectal fluids, and breast milk. Unprotected sex, sharing needles, and mother-to-child transmission during childbirth or breastfeeding are the most common causes. Symptoms can vary greatly, but they often resemble the flu: fever, sore throat, fatigue. As the disease progresses, weight loss, night sweats, and recurrent infections may occur. So how can we prevent HIV/AIDS? Well, safe sex practices, regular testing, using clean needles, and taking preventative medication if you're at high risk are all key. Remember, knowledge is power, and with power comes the ability to protect ourselves and others. Safe practices can prevent the spread of HIV/AIDS. Coming in at number 4, we have malaria. Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. It's prevalent in tropical and subtropical regions, including parts of the Americas, Asia, and Africa. The symptoms of malaria are similar to the flu, including fever, chills, sweats, headaches, nausea, body aches, and general malaise. The severity of these symptoms can vary based on the type of parasite involved. If left untreated, malaria can disrupt the blood supply to vital organs and lead to death. Now, how do we protect ourselves from malaria? Prevention is key. It involves controlling mosquitoes and preventing bites. This can be achieved by using mosquito nets and insect repellents, wearing protective clothing, and taking anti-malarial drugs. Also, early diagnosis and treatment can help prevent severe disease and stop malaria transmission. Preventing mosquito bites can help reduce the risk of malaria. At number 3, we have tuberculosis. Also known as TB, this infectious disease primarily affects the lungs but can also target other parts of the body. It's caused by a bacterium known as Mycobacterium tuberculosis. Now you might be wondering, how does one contract TB? It's spread from person to person through the air when someone with the disease coughs, sneezes, or even talks. Symptoms of tuberculosis can range from a persistent cough and night sweats to weight loss and fatigue. But here's the kicker: not everyone infected with TB bacteria gets sick. This is known as latent TB, and it's not contagious. However, the bacteria can become active, leading to full-blown TB, which is indeed contagious. So how can we prevent tuberculosis? Well, a healthy lifestyle is key. A balanced diet, regular exercise, and adequate sleep can boost your immune system, making you less susceptible to the disease. Additionally, there are vaccines available that provide some protection against TB. Early detection and treatment of tuberculosis can save lives. At number 2, we have hepatitis. A term that might sound familiar, hepatitis refers to an inflammation of the liver, typically caused by a viral infection. But it's not just one disease. In fact, there are 5 main types of hepatitis viruses identified by the letters A, B, C, D, and E. Each type of hepatitis has different causes, and they all present unique challenges. For instance, hepatitis A and E are usually caused by ingestion of contaminated food or water. Hepatitis B, C, and D, on the other hand, typically occur as a result of contact with infected body fluids, such as blood. The symptoms of hepatitis can range from mild to severe and may include yellowing of the skin and eyes, known as jaundice, fatigue, and abdominal pain. But here's the kicker. Many people with hepatitis may not even experience symptoms, making it a silent but potentially deadly disease. So what can you do to stay safe? Vaccination is key in preventing hepatitis. And finally, at number 1, we have influenza. Influenza, commonly known as the flu, is a viral infection that attacks your respiratory system, your nose, throat, and lungs. It's not to be confused with the common cold, which is less severe. Influenza can lead to complications such as pneumonia, bronchitis, sinus infections, and even heart problems. So what causes this ailment? Influenza viruses are primarily spread through tiny droplets made when people with the flu cough, sneeze, or talk. You can also get the flu by touching a surface or object that has the virus on it and then touching your face. Symptoms can range from mild to severe, including fever, cough, sore throat, runny or stuffy nose, body aches, headache, chills, and fatigue. Some people may also have vomiting and diarrhea. The best way to prevent the flu? Get vaccinated each year. Other protective measures include washing your hands often and avoiding close contact with anyone who has the flu. Getting vaccinated annually can help prevent influenza. And that wraps up our list of the top 10 most common diseases. We've journeyed through the complexities of cardiovascular and respiratory diseases and explored the intricacies of conditions like diabetes and Alzheimer's. We've delved into the harsh realities of cancer, HIV/AIDS, and malaria, and grappled with the challenges of tuberculosis, hepatitis, and influenza. Each disease, unique and potent in its own right, echoes a common theme: the crucial importance of prevention and early detection. By understanding these diseases, we arm ourselves with the tools to combat them. We learn the importance of maintaining a balanced diet, regular exercise, and routine checkups. We recognize the significance of vaccinations and timely treatments. We see the value in spreading awareness and breaking down stigmas. We realize that prevention isn't just about dodging bullets. It's about building a healthier, stronger, more resilient self. Remember, knowledge is power. Stay informed, stay healthy.